DACCO Behavioral Health has been providing services to thousands of people in the Bay Area for decades. And today, Linda Mann, Dr. Jason Fields, and Cinciana Bularca join me to break down how they are trying to help each person at a time. Welcome back to some of you. Welcome to the first time. How's everybody?
Doing great.
Thanks.
So, an incredibly important program that we're talking about today. And Linda, we want to begin with you because a lot of times you think of behavioral health, you think of addiction, but you don't necessarily think of pregnancy and the struggles that may be, and how when you combine them, that's where you come in.
Well, Family Focus serves pregnant women and postpartum women and their families, their children, substance-using women. What we do is the main core is wrapping them around with intensive case management, medical case management, getting them to the physician, linking them with an OBGYN so that they can get their prenatal care, and we track that. We take them to their prenatal appointments. We'll help them with their pediatrician after the baby is born. We even, if a mother's in the hospital and she has to stay longer than the baby, we will take that mom every day to visit her child to promote the bonding and to get that going. So it's multi-tiered, it's holistic. We want the mom to feel embraced by DACCO. That's our goal, so that they can do the best that they can do.
Why is it so important? And Doctor, I want to bring you in here. Why is it so important for mothers who have an addiction, whether it's the behavioral side or any of the addictions that kind of fall into this category? Why is it so important for mothers to seek help early? And of course, the resources that you just named, I mean, unlimited right there.
Well, pregnant women with substance use disorders can have some complications, and any pregnancy can be risky, but they're less likely to engage prenatal care if they are actively using substances. So as early as possible in pregnancy, we want to get them under our attention, under our paradigm of treatment, to bring them into compliance and stop using illicit substances and have best outcomes for them and their baby.
And the numbers speak for themselves. The statistics you have of women, I mean, that was pretty impressive. I'll let you kind of brag a little bit, if you will.
Yeah, we're really proud at DACCO for the Family Focus program. It's a comprehensive coordinated care plan. And what we do is the physicians, the nursing staff, the counselors, all the treatment providers work together collaboratively with their OBGYN as well to decrease and stop illicit substance use so they have a substance-free delivery. And over the last year, 90% of substance-using pregnant women enrolled into our program had a substance-free delivery.
That is just great. That is great to hear for those women. I know what struggle that can be. And a lot of this, too, is education. And that's where you come in as well, and talking about the educational components and how you are able to help patients. Where do you fit into this, Cinciana?
So through our partnership, Champions for Children and DACCO, working together on the Family Focus project, which is funded by the Children's Board, we have been able to offer parent education, child development play groups, and new mom support groups. We use a curriculum, evidence-based curriculum, Nurturing Parenting, that focuses on not only knowledge, parenting knowledge, but also changing the attitudes towards parenting to a more positive attitude. We offer the child developmental play groups as well, and that's an opportunity for the moms to practice what they learned in the parenting classes in a supported environment. And the goal is all attachment, building empathy, and creating new positive relationships between the parents and the children. And with our mission of growing better children and growing more attachment to support the better development.
You mentioned the resources when we first started, and now we have gotten to the why and how you're able to help exactly. Where can people go? Is there ever a point for a pregnant mom who's so far along that it's too late to get help? Or what do mothers need to know out there, or other family members out there, about getting more information and using these resources?
The women can come to DACCO 4422 East Columbus Drive any day. We have open access to intakes. Pregnant women are given priority into treatment. When they get into a treatment program, then we immediately see the Family Focus case manager to start helping them with the case management needs they have around the pregnancy.
Thank you so much for coming in. And again, just trying to change the stigma that is and surrounds addiction out there is important. So we're glad that you're able to do that here on the Morning Blend. And again, we want to share the information. There's the website that we were talking about, along with the phone number as well. If you need more information, do not hesitate. Reach out to DACCO today.